Oftentimes our body is giving off symptoms of something that's wrong, and we can make excuses for it by saying, I've overworked myself, or I just had a baby, anything like that. And the reality is it could be your thyroid. And according to Synthroid.com, the thyroid is a gland that releases a hormone called thyroxine. Men and women alike have this problem. According to WebMD, the thyroid influences all metabolic developments within the body. There are two types of diseases that you could have with your thyroid. There's the hypothyroidism, which is when your thyroid is underactive, and then there's the hyperthyroidism, and that's when your thyroid is overactive. The signs and symptoms of hypothyroidism is fatigue, sluggishness, constipation, pale, dry skin, puffy face, hoarse voice, elevated blood cholesterol levels, weight gain, muscles, tenderness and stiffness, pain, stiffness, swollen joints, muscle weakness, heavier menstrual periods, brittle fingernails and hair, and depression. And all these things can cause an end to your life if you do not take medication with it. There are two different types of medications that you could take. There's Synthroid and there's Armour. According to the Department of Health and Human Services, if you're pregnant in your first trimester, it can cause an effect in your infant's mental state. It could cause mental retardation. It could cause heart problems. The baby could be often stillborn. But these traits can possibly be prevented as long as you take the precautions and you take medication. According to National Thyroid Institute, 63.1 Americans are overweight, and this is possibly linked to thyroid issues. The obesity can be connected to diabetes and high blood pressure, heart disease, stroke, and high cholesterol. Also, the National Thyroid Institution says if you are pregnant, then there's always the possibility of premature labor, preeclampsia, possible miscarriages, and it can cause depression and mental illnesses. The thyroid is located in the neck, right in here, and it makes like a butterfly shape. My mom has hypothyroidism, and in her hypothyroidism, she found out about 10 years ago that she had this issue because she was trying to lose weight. She felt tired constantly, and so she knew something was wrong. So they tested her TSH levels, and a normal TSH level should be between 0.55 and 4, and my mom's wasn't. And so they had to put her on Synthroid, and she felt worse. So she wanted to take a more natural approach to it, so she decided to take Armour. Her sister also has hypothyroidism, and in her life, she's found out that her thyroid is attacking her immune system. And because of that, they have her on medication as well. After my mom went on Armour, she lost around 25 pounds and she felt more energetic. And so she was really pleased with the outcome of that. My Uncle Danny, he also has hypothyroidism, and he has issues as well, but he's taking medication, and so he's hoping for the best. My nanny also has hypothyroidism, and so you can see there's a genetic trait there, because I also found out about a week ago that I have hypothyroidism. And so I'm hoping it's not something that I pass on to my daughter. With having this disease, most people usually have to take medication for the rest of their life, but they can live a fairly normal life as long as they do take the medication and they're very careful. Thank you.